North Dakota is in a mental health crisis, but there is help and there is hope. Welcome to It Matters, a series of conversations aimed at fostering mental well-being in North Dakota, presented by Inspired Woman, where every story lights the way. I'm your host, Marci Narum. North Dakota is in a mental health crisis. Many people struggle not only with mental illness, but getting the services they need. Carlotta McCleary is the executive director for both Mental Health America of North Dakota and the Federation of Families for Children's Mental Health. She joins me now to talk about the needs in North Dakota. Thanks for being here.
Thank you, Marci.
Yes, so let's talk first about Mental Health America of North Dakota.
Sure. So Mental Health America of North Dakota, we are one of the few in the nation that is a consumer-run organization. So all of our board of directors, our staff, individuals that we serve, we all are living with lived experience of mental illness.
Okay. And how long have you been part of it?
So I've been with Mental Health America as executive director probably around 2015.
Okay. And what's your role, and what does Mental Health America of North Dakota do?
So Mental Health America of North Dakota is primarily an advocacy organization to ensure that North Dakota citizens have access to mental health, that we have enough services and supports that are available for individuals.
And can you walk us through, specifically, a case in point, how you would help an individual?
So when individuals come, we have a couple of different things that we are doing. So in Grand Forks area, we actually run a recovery center, which is a drop-in center for individuals, adults that have a mental health need. They're able to go in there and find some recovery classes, understand more about mental health, the ways that they can get engaged and start kind of having more of that social interaction with individuals. There are peer support groups that we offer, as well as, just activities, getting people active again in their community.
So we're in a mental health crisis. What does that really mean?
So a mental health crisis is really when you have more mental health needs that are going unmet. And so in our state, we certainly do have more mental health needs, and we are lacking enough services and supports right now.
Okay. And why is that? Why is it so hard to find the services and for people to get the help that they need?
Stigma does play a big role in this. This is the only chronic health condition that we wait until stage 4 of the condition to do anything about it. You wouldn't do the same if you had diabetes, heart disease. We try and get in there and work as soon as possible to alleviate. There isn't a fear of going in and saying, hey, I might have diabetes, or I might have asthma, I have a heart condition. Those are things that people, sometimes we talk about the casserole support, right? People will bring you a casserole and support you with that. But we aren't necessarily doing the same type of support when it is a mental health need. And so we need to think about mental health just like you would any other chronic health disease. So you can look at early intervention, prevention, all of those things, and get people to the supports and services that they need as soon as the onset.
And what's holding us back from getting that help?
So right now we do have a lot of things that are out there. Certainly we had a decrease in the 90s and late 90s and 2000s, where we had a decrease in the number of people that were accessing services, and our system basically collapsed. And what we saw as a result of having less mental health services, we saw an increase of people being served in the justice. 2/3 of the judges were sentencing people to prison in order to access services, and to jail in order to access services. And we saw the same in our children's system, kids going into the juvenile justice system. So people needed, there were less people being served, and now we also have, on top of that, we have a workforce shortage. Also coming out of COVID, we also believe that there is an increase in the number of people that have been impacted by mental health needs.
And was some of it, you think, a result of COVID, or just that it came to bear during that time?
Right. So when you look at things that can cause difficulty, isolation is exceptionally difficult for somebody that has mental health needs. We want to get people out and see other people. So that isolation, you had a lot of fear. I mean, people were worried about loved ones. It was a time of people being kind of fear. And anytime we have a crisis, people can have some difficulty with that, some trauma that occurs as a result of that.
Sure. What is the prevalence of mental illness in North Dakota?
So for adults that would have not just any mental illness, but adults that would have it impacting more than one area of their life, that's what we call serious mental illness. And the prevalence rate for that is about 7% of adults have a serious mental illness. In North Dakota, that would translate to 41,000 adults. And so our public system served just under 5,000 adults statewide for the last fiscal year, which was July 1, 2022, until June 30th, 2023. And then 559 adults received ongoing case management or ongoing services. So the need is a lot more than what we're able to provide services for.
And when you mentioned the workforce shortage, are we talking about, there's a need for more therapists, counselors, social workers?
Absolutely, all the way down. And I think what we need to do, again, stigma, we need to let people know that this is a real need. We need to get to our young people who are thinking about a career. This could really use a lot of assistance, and somebody that has some caring, you could just really be thinking about a job in that field, that would be really, really helpful for North Dakotans.
And when we're talking about mental illness, there's this serious mental illness. Is there kind of a range that we're talking about? Depression, PTSD?
Correct. So there's many, when you talk about depression, post-traumatic stress disorder, those are all conditions. And so you can have a mental health condition that is diagnosed, and what impacts it, whether or not it's serious mental illness or any mental illness, would really be that impact that it has on your life. Are you able to still go to school, go to work? How are you functioning at home with your loved ones? How are you out in the community? Is it impacting your community engagement? And so all of that plays into whether or not it's considered a serious mental illness, or for kids, it's called serious emotional disturbance. And it's really just that impact. It's actually a definition that SAMHSA did in the federal law about it. So it's not necessarily a medical diagnosis of SMI. It just really goes to the chronicity of what somebody is working with.
Just that daily impact of work,
right.
And relationships and all of that.
Yep.
Okay. So how do you help an individual maybe who calls the Mental Health America of North Dakota?
So we do have some navigation and a helpline that we are working with. And so we utilize, when people are calling in looking for help, we can help them, individually help them find counselors, some therapists in their area, what kind of services and supports that they can have. We've gone around the state to really kind of try and keep up on what's happening in each one of the regions, because everywhere in the state is a little bit different. Obviously, the Fargo, North Dakota of the world is going to have a little bit more than the Dickinson, North Dakota of the world. And so you just kind of get into kind of understanding what's all happening and what kind of services and supports they have in that area. The Behavioral Health Division also has a wonderful mental health directory that has mental health professionals listed there, their numbers, what kind of treatment they offer. And so that's also very helpful for the public, and we utilize that as well.
Okay. But if there's a shortage of providers, then is there a long wait time? Is that what we're...
That's correct.
Part of that
so
crisis?
sometimes, right. So sometimes there can be a long wait line. It really does depend upon where you're going for supports and help. And so, and it isn't like an ongoing thing that's constantly changing. You might have a new therapist that is just opening up shop for the first time. So they might have availability, and you might be able to get people in a lot sooner. So it just really depends on a lot of different things. But yes, typically it can be long wait times. And so we need to let people know when they are in those wait times, if it is something serious, what other resources that are out there, such as if they find themselves in a crisis. We need to remember that 988, instead of 911, our mental health emergency line now is 988, and we can call and get help.
Okay. And what help is there at the end of that line?
At the end of that line, it's actually answered by First Link in Fargo, and they do a wonderful job of really helping maybe de-escalate the situation, the crisis, and a lot of times they're able to de-escalate that over the phone where nobody else is needed and they're okay to go until are seen regularly. Other times, they need to have maybe a crisis response team go out and kind of help talk to the individual and make sure that they're okay and doing well. This also prevents unnecessary hospitalizations and unnecessary encounters with law enforcement. So this mobile crisis unit and or the 988 number and getting to crisis help is really, really beneficial. It saves lives and it saves people from going deeper into the system.
Wonderful. And where is that mobile crisis team available?
So the mobile crisis team is available in 45 miles radius of kind of like the 8 major cities. So we'll start like in Williston, 45 miles of Williston.
Okay.
Then you go over to Minot is another area. And so again, they have that 45-mile radius. And then Devil's Lake, and then Grand Forks, Fargo, Jamestown, Bismarck, and then Dickinson.
Is there anything else about Mental Health America of North Dakota that you wanted to talk about before we switch to the other agencies?
I really think that, again, Mental Health America does a great job of advocating, and so anybody out there that thinks that we could use more services and support, that advocacy. For workforce development, we need things like loan forgiveness, to help people get into the field. We really need to be looking at things like that. And then more funding and support. We are looking at, hopefully, the human service centers, which are our public system, developing into certified community behavioral health clinics, which will then have 24-hour services, serve anybody who is able to walk in and get served. They will be able to serve them. And so there are a lot of wonderful services, and we're hoping to be able to move in that direction. And so to move in that direction, there's an upfront cost to that. But then after that, it should be able to be supported through your medical reimbursements.
And so that would also be regional?
Correct.
Okay.
Yep. We hope to have, our dream is to have one in every one of those major communities.
Okay. Well, I hope that works out.
Yeah.
Let's switch and talk about the North Dakota Federation of Families for Children's Mental Health, which is a mouthful.
Yes, it is. It's a very long title.
But what is that organization and who do you serve?
So the Federation of Families is a family-run organization, so families who have raised children that have mental health needs. And we have what we call parent coordinators who provide like a family and parent peer support. So who just help other families navigate through the mental health system. And for children, it's not just mental health. It impacts their education. It impacts sometimes child welfare, our juvenile justice system. So sometimes our kids are multi-system kids. There's multi-system involvement at times. And so we need to help families with whatever they come in and whatever that need is.
And how do they seek that help? Is it a helpline again?
They just call in and we will serve.
Okay. What if we are seeing kids that aren't being served, who need mental health services? What could the result be?
A lot of times what you might see sometimes is some behavior in school. I think our schools are really dealing with a lot of the unmet need. Our families are dealing with a lot of that unmet need as well. And so I think schools are wonderful. They've got a lot of resources in schools as well, but we need a combination of everybody working on this. What we have found is like the wraparound process, wrapping services and supports around families, looking at their strengths. When there's a problem, we don't talk about it being a problem or a bad parent or a bad kid. we talk about these as being unmet needs. And we need to look at this more about this is not just a bad child that's causing all this chaos and problems. This child has unmet needs. And how do we fill the needs for that child and that family and wrap services around them?
When somebody calls in and is looking for support, then it's one of those family members that is the family-run organization that they're helping connect them with the proper services.
Correct. And so it's whatever the family identifies as being the need. Our parent coordinators go to meetings with families. So if there's a school meeting or the child needs to maybe take a look at being evaluated to determine if they need special education services, we're able to go with that family and provide that support, information, education about what is special ed, what's going to happen at this time, and just really walk them through what's needed. And whatever they are, sometimes families may be dealing with food insecurity. That would be something that we would work with too. For both kids or adults, we want to deal with whatever those unmet needs are to try and wrap services and supports around the family so that they have their needs being met.
Okay. What is the prevalence of mental illness in children in North Dakota?
So for children, again, and I'll give you I think like any mental illness, it's 1 in 5 kids. But if you look at kids that would have a more serious need, that really ongoing services and supports, we call that a serious emotional disturbance, and that is roughly 10% of our population. So in North Dakota, that translates to 18,000 children are in need of some services. And our state system provided services and supports to just over 1,000 children last fiscal year. And then 73 children statewide received that ongoing case management. So you can see that when we talk about SMI, that 41,000 or 18,000 children with SED, there is an obligation that North Dakota has to serve all of those. So all 41,000 adults and all 18,000 children should be receiving services and supports. Now, the state doesn't have to do it alone. It can be a partnership with private entities as well. But we should be serving all of them. That is the mandate that's there.
Is there anything else about the North Dakota Federation of Families for Children's Mental Health that you want to share?
I really think that, again, we need to reframe how we are viewing people, children, adults. We need to look at everybody has strengths that they come with, and we need to look at the strengths. We need to stop focusing in on all the negativity, all the negative things that aren't going well, all the problems. And when we do have problems, we need to view them as unmet needs. When you do that reframing of seeing people with the strengths and unmet needs, it changes how you view people and how you treat people. And it also will help you have more compassion, understand. I mean, it really helps with that stigma, and sometimes, quite frankly, it's discrimination that happens with mental health needs. So we need to change how we're thinking and feeling. It changes how people respond to children, how people are responding to adults, and with that response difference, then we have more compassion, we provide more funding and support, and we just are a better supportive community. And again, we've got to get to people before stage 4.
Can we go back and talk about something else that Mental Health America of North Dakota offers, and that is some online assessments?
Correct. So our National Mental Health America organization has a lot of wonderful mental health screens on there, and you can take those in the privacy of your own home. If you're just wondering, do I have something that might be a mental health? I mean, because a lot of people are nervous about it. Do I have this? And if you want to check it out at home, just for yourself to see, you can have a screening available. And those screens are not diagnostic, but they will give you an idea like, yeah, it looks like you should probably go in and see somebody. So Mental Health America does a really nice job of going in and giving them the next steps after those screens are done. But people might want to have, they kind of wonder, I kind of wonder. We have, my husband just did kind kind of wondered, after years, and he's in his 50s, right? For the first time, he thought, I think I might have ADHD. And sure enough, he did. And he was able to receive some ADHD medication that really helped him out. And so, we wait sometimes too long. We have this inkling that this might be going on. But again, taking a screen, going in and talking with your doctor, and have it checked out.
And when you say it's not diagnostic, but do you get the results so that you could then take that to a provider?
Correct.
Okay.
Yep, they will give you all those next steps and be able to kind of move forward with that.
All right, and that's all through the
And so we just
national website.
Right, and so we just revamped our website, and so those screens will be on our website. And also that Get Help, there's a Get Help section, and that section will also take you right to our navigation page, to try and help the helpline, try and help people navigate the system. Just give us a call. And whether you're calling Mental Health America or the Federation of Families, we're both affiliated. We have the same administration, so you're going to get the right place.
Okay, easy enough. Thank you so much, Carlotta.
Yeah, thank you.
Important message and work that you're doing. For more information, you can call 701-255-3692 or call toll-free 1-888-705-5763. And again, you can visit that website at mhand.org. If you or someone you know is experiencing a crisis, though, please call that helpline at 988. That's all for this edition of It Matters. I'm Marci Narum. Join us again next time.